Section 6. The Whitening Procedure. Start by placing the zoom light guide on the Philips zoom lamp head. Turn the lamp on using the power button located on the side of the power pack. When the light guide is attached, the display will read Guide Status, Guide Attached, followed by 4 of 4 sessions, indicating the remaining sessions available and total sessions available. Next, remove the cap from the room temperature Philips Zoom whitening gel syringe and attach the mixing tip. Now, apply the gel directly from the syringe to the teeth, about 1 to 2 millimeters thick. Use the brush provided to ensure proper placement of the gel. Raise the back of the chair so the patient is in a slightly reclined position at about a 45-degree angle. Let the patient know that they can swallow normally during their whitening treatment. Align the light guide to the isoprep retractor. Place the end of the retractor into the slots located on either side of the light guide. Begin the whitening session by pressing the intensity button and selecting the desired option. You can choose from high, medium, and low light intensity. Start with the highest light setting and adjust to patient comfort. Patients at a high risk for sensitivity should start on a lower setting. Next, press the Start button to turn on the light and activate the session timer. It's normal for the light to flicker for the first few seconds. Press the Pause button if the session must be interrupted at any time. To reactivate the session, press only the Pause button, or the fourth 15-minute session will be lost. Let the patient know that the white speed lamp will beep once when 3 minutes are remaining, and will beep again 3 times just before each session ends. Point out to the patient that the progress of the session will be tracked by the 4 lights on the top of the accelerator head. A light will appear for each quarter of the session. These lights are also helpful for checking on the patient's progress and time remaining. Be sure to check on the patient regularly during the whitening treatment. If you plan to leave the room for an extended time, provide the patient with a means to contact you, such as a small bell. It's also helpful to have a pen and paper available in case the patient needs to communicate with you. When the time reaches 0, the light will turn off and the long beep will sound. After each 15-minute session, remove the light guide from the retractor and gently pull the white speed away from the patient. Avoid changing the angle of the white speed arm or the lamp head to minimize readjusting for each session. Next, carefully remove the gel with a surgical suction tip and check the isolation materials to ensure no pink tissue is visible. If the patient notes irritation at the margin, use vitamin E oil to soothe the tissue. If the patient notes tooth sensitivity, you can lower the light intensity on the lamp to medium or low. You can also apply the Relief ACP gel on lingual surfaces for the remaining sessions. The Relief ACP gel is provided in the patient post-care and maintenance kit. Reapply the Zoom whitening gel, align the light guide to the isoprep retractor, and begin the next session by pressing Start. Repeat these steps for each of the 3 sessions. For patients darker than A3 or if deemed necessary, a 4th session is available. Be aware that additional sensitivity may occur, and patient comfort should be assessed and taken into account.